Hi, church family. Alan Baggett here. Listen, it's been a while since I've had a chance to see so many of you and get to interact. And to be honest, it's a complete honor to be in front of you today. I'm so thankful for all the prayers and the calls and the text messages that you've sent to me and my family since this shelter in place began. You've been praying for all of the healthcare providers, and I just wanted you to know that it's been felt and appreciated. The purpose of my appearance today in front of you is to really review the plan that our shepherds have laid out and to really provide some education and a handful of recommendations as we move towards our anticipated church reopening. We have a lot of information to cover, and I very much appreciate your willingness to follow along in all of this. On the educational and information front, our area has been completely remarkable in its battle with COVID-19. Madison County and Huntsville has had one of the lowest per capita rates of infection and attributable deaths related to the disease, all the while being the third most populated county in Alabama. Local health professionals, myself included, don't completely understand why this is the case across the whole area. But what we know is that the sum of evidence suggests that Madison County and the population here locally made some incredibly wise decisions early in the outbreak. And due to those decisions, led to significant reduction in rapid spread of the disease, not only here, but throughout our area. When we started this discussion back in March, I talked to you about flattening the curve. And friends, we have done that incredibly well, been very successful, not only locally, but again, across a vast majority of the nation. And I'm so thankful for that. As time has passed since March, health professionals have continued to learn about this disease and its transmission rate, things about environmental risk that increase exposures, additional personal risk factors that increase the severity of disease. And we've also seen some variations in how COVID-19 presents in patients, symptoms that weren't previously known or seen just a few months ago. Kids can have rashes, adults can present with nausea and vomiting. All these things have been new. We've gained a lot of insight, and we're looking for ways of managing the illness moving forward. We know that this illness continues to be primarily transmitted through aerosols, and those that are exhaled or expelled out of the mouth of a contagious person. We know that viral shedding can occur now days before clinical signs appear. And there continues to be evidence that a large percent of people who are sick with COVID-19 are completely asymptomatic, meaning they have the illness, but they don't have any signs or symptoms. These people are very capable of transmitting the illness to someone else who may not be as lucky. We now know that secondary transmission from surfaces is much less likely. So the good news is you probably don't need to worry about that Amazon box sitting on your porch or grocery store shelf items. Routine hand sanitation, sanitizing, and limited direct contact with other individuals is likely all that's necessary to limit the risks associated with direct contact exposures. Mask wearing appears to be highly beneficial, and I need to push that, specifically if the infected person is wearing one and others in proximity are following suit. If we all wear masks and limit the time of exposure in a contagious environment, transmission rates are exceedingly low. That's super important for us. While our local area's low rate of infection and all of this new information is a wonderful thing, it does not mean that we are out of the woods. It does not mean that this is something that we can just swipe away and not worry about. And I really want to stress that point. A couple points to think about. A low true prevalence, meaning a low rate of infected in an area, now provides little to no benefit to us as we move forward into the future. There continues to be a real potential for resurgence, a second, taller curve, as was seen in the 1918 influenza pandemic. Because our local prevalence is so low, the likelihood of a greater outbreak here, or a significant outbreak here, may actually be greater due to limited to no herd immunity. Friends, herd immunity, that's the thing that gets us out of this. That's the real way to exit the COVID-19 pandemic. I've heard countless responses to this problem, and in reality, what I would want to remind you of is this. Whatever path we choose, we should choose a path that prevents preventable death. That in reality is what I say when I mean we must remain vigilant. We must remain conscientious of the decisions that we make before a rock-solid vaccination is in place and becomes widely available. This is where it comes down to you and I. We must all take responsibility. We must all be aware and manage our personal risks of transmission. Remember that though our prevalence is low, COVID-19 has not left and certainly should not be considered a zero risk threat. The good news is this. Based on current local information, pending ongoing review, I do believe that we are right now at a point where the risk of our meeting together for worship is low enough to do so. But I must include this following caveat, as I've suggested to you above. We must be wise in doing so. When we come together as a body of believers, we must be wise. When we go to a public place, we must be wise. The sum of all of our personal decisions matter, not only to our personal health, but to the health of those around us. We can be precautious here, but lax in another situation, and that increases our overall risk. I hope you see that. And it certainly increases our risk of bringing it back into another area where we want to be careful. I don't want to be a viral vector. And I want to reiterate to you that the decisions we make can have huge impacts. And I think, to be honest, we want our impact as a follower of Christ to always be a positive one, right? Now and in the future. So from a spiritual standpoint, I think we would all agree on this. The decisions that we are called to make as Christians should always and consistently reflect a love for our Father, a love for each other, and a love for our community. Jesus said this in John 13:35. He said, "Your love for one another will prove to the world that you are my disciples." So as we move forward, let's remember that in all the things that we do. Let's take a strong consideration to display care and love, because it is an expression of who we are as believers. I am incredibly thankful for the diligence and thoughtful consideration that our elders have gone through over the past several months. And they've undertaken so much to protect you and I and our community from the beginning of this pandemic forward. Again, I remain committed to the belief that local decisions such as those made by our elders here, our shepherds back in March, have been a big part of the reason why our area's prevalence is low and why we have so far been so successful. As we look to reopen, many of the policies that our elders detailed to us back in early March need to remain in effect. And this is probably going to be the case for the foreseeable future. Some of these policies you have heard, some of them will undoubtedly be new. Several of the recommendations that I'm going to cover are going to be awkward, perhaps against our prior sense of normalcy, and they may be even mildly annoying and uncomfortable. But in order to bear these things and to keep that love and focus of safety in mind, we do these things because we love each other and because we love our community. I wanted to convey that though our risk is low here locally, that can change very quickly. I believe it's to be in our best interest as a church to plan as though the risk of a contagion is present than it actually is in the moment. That's being cautious. Going above and beyond, even in the small ways, makes a large impact if done very well. All right, I've told you a lot of things, but let's get to the recommendations. Here's what the elders have encouraged for us all to follow. We will plan to reopen for indoor Sunday morning worship services on June the 7th at our typical 9 a.m. time. Research has shown that both the risk of COVID-19 infection and the severity of illness is directly related to the cumulative amount of virus that a person comes into contact with at the point of exposure. Multiple case studies have identified that breathing in a large volume of virus over a period of time is a clear trigger to symptomatic disease. So that exposure can occur quickly, right, by being within and breathing in a dense cloud of viral particles. Let's say a symptomatic person coughs on you as you walk through. That same exposure can occur over time with repeated or continuous smaller quantity exposures. Think about being trapped in a sealed room with no air exchange, with a contagious person breathing the same volume of air that you're breathing. Eventually, if there's no air turnover, you will be breathing each other's air. That's just the facts of things. But because we're meeting indoor, we must account for both of those risks. So we are encouraging you to wear masks. I'll talk about that more in a moment, in a moment. But we will be cutting down, by wearing masks, we're going to be cutting down on the time of potential exposures as well, by not having our typical Sunday morning Bible class time or Sunday evening services at our building. That's to, again, alleviate the total time that we are exposed together. Social distancing must continue to be a concept that we live by. Those who are self-determined to be high risk to transmit or become ill from COVID-19, the elders and I would continue to encourage you to remain at home. These are our individuals that are of age, that have multiple illnesses, or at risk for other medical conditions in their lives. It's important that this decision is your own, and we understand that this decision comes from a very personal risk analysis. If you decide to stay home, we all understand and we support you. We do want to hear from you, and we're going to check in just to make sure that you and your family are doing well during this period. We're separated by distance, but we're not separated by our heart. We don't want anyone to be spiritually, physically, or financially, or in any way suffering in silence. So please keep that contact open. As you know, our church service is always live streamed through YouTube for those who can't be present. And if you don't have access to that, we'd recommend that you watch Gary Bradley's local television program to stay involved and to stay spiritually active. We highly, highly, highly encourage anyone who is ill. If you have a fever, a cough, you have nausea, vomiting, generalized fatigue or malaise, or goodness, you just don't feel well, please stay home. If you've been diagnosed with COVID, as per the Alabama Department of Public Health and the CDC guidelines, you need to remain quarantined for at least 14 days as you've been directed by your providers and physicians. If you're being tested for COVID-19 and you don't know the results yet, also please stay at home until you're known to be negative. This is also an Alabama Department of Public Health policy. As you may have heard through our local news stations, a graduating senior at a North Alabama high school went to an indoor graduation not that long ago after being tested for COVID-19 in the days prior. He had not gotten his results back. The event went off as planned, but after the ceremony, the student was informed that he was indeed positive for coronavirus. Before the test resulted, I guess I say that because of this, before the test was resulted back, I'm sure that student felt his risk seemed low and the benefit of going seemed so high to that person and to his family. But retrospectively, I doubt they feel the same way. I am so hopeful that no one at this event got sick after the event, but I bring it up to make this point. Depending on our outlook and our mindset, the risk frequently seems small before we encounter such a catastrophe. If you've been exposed to COVID-19, please be judicious and consider your risk of asymptomatically exposing others to the disease. Though I dearly miss you all, my exposures at work continue to place me at higher risk. So much so that today I was unable to get my teeth cleaned because of their screening questionnaire and protocol. I cannot be an asymptomatic vector of transmission to you, and I don't want that to be the case. So to give you a little insight into my personal plan for this, I am monitoring my ongoing COVID-19 exposures, and my family and I will remain separated from you until I have at least 14 days from seeing a positive patient in the hospital. Listen, I, like so many of you, want to be present here, but I cannot put my selfish desires ahead of your health. I really love you too much for that. My family and I will continue to be involved in our ministry programs here as a church, And to be very clear to you, I am always available to you. Phone, text, email. Hey, and if you need me to come out to your house in person, and if that'll be a benefit to you that outweighs that risk of exposure, let's do it. Meredith and I will continue to actively look forward to that day where we can be back here with you safely. And I would encourage us all to pray that that day comes soon for all of us. Our elders want to highly encourage families, those that are specifically living under the same roof, to enter our building together and sit in the auditorium as a family unit. These family household units will be asked to socially distance from other units at the times when they're in the building. We encourage families, these groups, to allow appropriate space when walking and interacting. We understand the desire and the tradition that is to meet and greet in this wonderful space that I'm sitting in. But for now, we like this lobby area to be more of a hallway than a place to linger and loiter. That is just, again, to limit the exposures that we take on and put on others. So keep your distance. Avoid that urge to have direct contact, to give the hug, to give the handshake, and keep that personal space in mind. It's going to be awkward, but we do it, again, because we love each other. And if you desire to spend some time, if you really want to get some close interaction with folks, we want to encourage you to do that perhaps out in the parking lot, outside before service or afterwards, to have that level of interaction. That helps us keep the flow going in and out of the church, and again, to minimize time in an enclosed space, such as our building. Seating in the auditorium needs to be every other row, and this allows for 6 feet front to back between households. The elders have also required or recommended 3 seats between each family unit, so on a particular row, 3 seats between. They want to encourage our members to sit in family groups, again, as I've said, by household, and as you come in to fill the auditorium from the front, beginning in the front, all the way to the back. I know that's going to be a little frustrating because that personal seat of yours, you might not get to sit in for a little while, and I'm so sorry for that. Communion packets will be available at the doorway to the auditorium when you come in, so be sure to pick those up and grab enough for your family as you enter the auditorium. Your contribution, as always, can be dropped off in an offering plate as you enter, as you will see, or you may continue to give online, as those who have been doing so may continue that. Again, I want to reinforce, mask wearing is highly encouraged during your time in the building especially. And in reality, I would highly encourage you to wear it when you're out in public, especially when you're in indoor spaces, the grocery store, restaurants, or any other indoor activity in the public, to limit your aerosol exposure risk. We know that this is higher in indoor and enclosed spaces, and it's significantly higher during activities that we're going to be doing as a part of our service. Here's some info. A single individual who was infected with COVID-19 infected 84% of the people in his choir room after a rehearsal that lasted for 2.5 hours. Out of that group, 4 people were hospitalized and 2 died. None were social distancing and none were wearing masks. The point is, one person can have a humongous impact, and singing probably has a higher risk. Wearing a mask is not going to be perfect. It's not a perfect solution. But what it does is undoubtedly catch large and high velocity aerosols. And it's been shown to decrease the risk of transmission if used in higher risk environments, much like our building. Given a 45 to 65% asymptomatic carrier rate of infection, it's important that we all wear one. We wear masks to protect others from asymptomatic transmission. Symptomatic folks should stay at home. It's the asymptomatic carriers that concern me as a physician. If you don't have a mask or the one you have causes you problems, don't worry. We've got lightweight over-the-ear mask on standby, and we'll be happy to provide you one at the doorway to our church. Lastly, our plans for Wednesday night class and our historic summer youth series are still to be determined. The church, based on church attendance and teaching capacity. Be on the lookout for additional information on this as it becomes available to us. Lastly, let me just say this. Thank you so much. I humbly know that is a lot of information, and some of it's probably more boring than others. And you just want to get back here. I know it's how important it is for us to come together as a family. And though it's not going to be the way that it was for a while, I truly believe the time that we can share, that we're sharing together, can both be meaningful and safe if everyone works together and remembers that everything we do out of love for one another. Thank you so much, church. I love you and miss you so much. If you have questions or concerns, or you're just curious about some aspect of this, please feel free to call out, reach out to me. I'll be happy to help with anything that comes across your mind. Thank you so much, and don't forget to wear this. Have a wonderful day. Thanks.